Hi, this is Dr. Anthony Cave, and I'm going to share with you one of the phrases that really bothers my patients a lot when they hear it in the moment, but oftentimes they come back days or sometimes weeks later and thank me for saying it. And this is patients who are in pain, often chronic pain or fibromyalgia. We talked about that in a recent live, and this is that famous saying, pain is all in your brain. This can be so triggering for so many patients, and I really want to share with you why, in the right time, in the right setting, with the right respect and dignity, this can be one of the most transformative and life-changing things that a doctor can share with you. But there's many barriers in the way to that message actually reaching my patients and helping change their lives in the ways that we're going to describe. But I need to share with the story that happened not too long ago. A patient who had no fewer than six surgeries in their throughout their spine, from their neck down to their lumbar. So that's up here, all the way down near your butt area. And they had unfortunately suffered from what's called failed back surgery syndrome. They originally went in for what's called a radiculopathy, where there is shooting pain down a particular nerve root. Ended up with scar tissue that caused pain in different areas after the first surgery. They went in for what's called a revision to revise the original surgery, and now pain went to a different area than ever before. And you can imagine revision after revision after revision until they have what's called the failed back surgery syndrome, which is unfortunately more common than we often think before we go under the knife for back surgery. But this patient had come to me because of their back pain, which really even went up to their lower neck area. And we spoke for a while. And throughout our entire discussion, and as you may or may not know, I often start my discussions with patients asking them why they're here, what had led to them coming to see me in the first place. And I heard the story that you just heard from me. And I asked, at any point, this is shocking to me. All I asked was, at any point, did you ever feel unsafe walking into the operating room? That was all I asked after I heard a longer version of what I just shared with you. Have you, or had you ever felt unsafe walking into the operating room? They paused and said, Doctor, I'm telling you about my back pain, about my neck, and why it's been hurting for months and years. And you don't give me the pill, you asking me these questions? That's literally how I was responded to. Well, after reassuring that I heard their story, and after I made it very clear that I empathized and entirely appreciate the pain that they've been living in, constipated and nauseous from opioid after opioid after opioid, they finally told me yes. Not once, but twice, they had felt incredibly unsafe going under the knife. And that opened up a discussion to PTSD. In this case, what we would call medical PTSD, which, as you know, is aggravated when we have anesthetics on board that fundamentally alter our brain neurochemistry and cause certain emotions to go suppressed forever, partly because we don't remember them fully because we're unconscious for the experience of the anesthesia. And when that physical trauma is happening to our body, when it's compounded with the emotional trauma that may have been there before we ever even entered the operating room. And you can see how, before you know it, we go from talking about back pain to talking about emotional pain, betrayal from what surgeons had said and what surgeons had not said. I'm not saying surgeons are bad people, and I'm certainly not saying that this individual patient was a weak or fragile patient. I am sharing that when we say pain is 100% in the brain, we need to recognize two powerful concepts. And please, please take these to heart. And I encourage you to reflect on them and recognize that this is not gaslighting. This is not normalizing. It's not manipulating patients into rethinking their sanity, manipulating patients into thinking that it is okay to live in a state of physical and emotional suffering. No, we're putting that aside. And please, uh, after the recent video comments that we had a whole nother video on about patients that are suffering because of the pendulum of the opioid epidemic, not getting their pain treated. This is a whole different discussion. We are not talking about undertreating patients because that is wrong and it leads to physical and psychological harm to undertreat pain, not necessarily different than overtreating pain and leading to overdoses. Neither underdose nor overdose is correct. We want the right dose for you. But we need to understand these 2 points. Number one is that tissue destruction is not necessary to feel pain. And number two is that tissue destruction is not sufficient to feel pain. So, what I'm saying, and it's not just me saying this has been shown time and time again, tissue destruction, what we call a noxious stimulus, is neither necessary nor sufficient to cause pain. You need to have an organ that perceives and somehow translates that tissue destruction or absence thereof into pain. Well, that organ is what we call the spinal cord in the brain, the central nervous system, without which you simply cannot feel pain. If you are brain dead or if you are unconscious under anesthesia and a surgeon cuts you, we don't say the patient is in pain because they are unconscious. Their brain is not awake enough to process the signals coming in. So while there might be tissue destruction, and there absolutely is under surgery, we don't say that we leave patients in pain when they're having surgery. It's very important to recognize how different this is than patients who believe that any small trigger to their physical body is going to lead to pain. This is what we call cognitive rigidity. And this is where this particular patient, just so you know, was trying to heal from this cognitive rigidity, and they were receiving ketamine from me to try to break the cycles of cognitive rigidity. That's what we're going to talk about, and how PTSD can wind up your central nervous system so that the smallest trigger can unload one heck of an explosion from the firearm that we call the central nervous system. As a quick shameless plug, if you appreciate me coming on here and sharing these stories with you before and after the operating room, before and after seeing patients, I really appreciate your support to share what you've learned with others, to advocate for yourself. Because this is a broken healthcare system that we all live in, that you are involved in as much as I am. And I want you to take away this knowledge to empower yourself and your loved ones and those that you care for to speak up for yourselves. Because unfortunately, and it pains me to say this, nice patients end up last, sometimes, not always. So please be empowered to advocate for yourself and ask the right questions of your doctor, especially if you are suffering from chronic pain or fibromyalgia, which we talked about yesterday. And as always, if you hit that like button and subscribe to keep up with all the lives, that's always appreciated so I can do this more for you. So let's go into PTSD and why is there so much correlation, if not causation, with fibromyalgia? You have to imagine the body as this fluid entity. We can be so resilient. We can take the punches of life, seemingly to no end, when we have proper external support and internal coping mechanisms. It's a balance of the two, undoubtedly. If you don't have support from the external world, you can't be healthy holistically. If you don't have the right inner coping mechanisms, and the inner resilience, you can't be fluid and take the inevitable hardships and adversities that life throws at you. When we have PTSD, whether it's under surgery, under anesthesia, in young adulthood, adolescence, childhood, these tighten up, they wind up our central nervous system, quite literally. In some cases, we actually have scientific names for this. It's called central sensitization. It can lead to things like allodynia or hyperalgesia. There are all sorts of names we can give these, but they all revolve around the same concept of winding up. Actually, one of the other names is called the wind up phenomena, where we literally wind up the central nervous system. And small stimuli that ordinarily you or I would not even recognize, we just blow it off, can trigger a massive release of neurotransmitters, some of which include substance P, as you may or may not know, which can then cause a heightened perception of pain. It doesn't mean that that tissue damage or that tissue stimulus, maybe it was pressing on skin, doesn't mean it wasn't there. It absolutely was there. Yet there is a difference between this sensation and what the brain feels. And I am sharing with you that without a brain, you cannot perceive pain. So something between the periphery that felt the pain and the spinal cord and the brainstem and your brain amplified the perception of pain. This is not controversial, by the way. What is controversial, I shouldn't, actually, it's not controversial. What is, I should say, wrong is gaslighting patients by copying out, treating their pain, and saying, oh, it's all in your head. That doesn't give appreciation and recognition, nor does it acknowledge the dignity of the individual in front of you who has come to you suffering, trying to be healed, trying to help you engage their healing potential. So I'm not gaslighting, and it's not normalizing the suffering of any individual. Please don't take it that way. Please recognize that there is a signal that goes from wherever the tissue damage is, your hand, your toe, your appendix, wherever, to where it reaches your brain. What can amplify these things? Past traumas. What else can amplify these things? These signals? Fibromyalgia. Yesterday, I was telling you how, why is it that in patients who have fibromyalgia, it's not just pressure allodynia, it's even heightened auditory sense. In some cases, heightened visual stimuli perception, where like bright lights can be pain-inducing or be highly uncomfortable, as can emotional stimulus. And this is where the concept of sensitivity versus fragility is so important to distinguish. Patients get so upset with me when I even raise the word sensitive. Not because it's not a bad thing. Remember, being sensitive is nothing more than being perceptive, either to your inner self or your external world. How sensitive is your detector at picking up changes in yourself or around you? The more sensitive you are, the more perceptive you are. Like that quiet sound to someone might be quite loud to you. Maybe you feeling a sense of unease in somebody nearby you. If you're sensitive enough to pick up on their emotion, you are sensitive, you are perceptive to it, as opposed to being mindless and aloof and like, oh, whatever. Same goes for pain. The more sensitive you are to the perception of that pressure on your finger, thumb, wherever, right? That is a measure of sensitivity, not fragility, where fragility is on a spectrum of resilience. So when patients melt down and break down and have these kicking, screaming episodes with me in the operating room, sometimes that's a marker of fragility because their coping mechanisms and resilience cannot withstand the stress or the trauma that their body is very really going through. Not because they're sensitive, they're fragile in that particular case. And once again, I'm not normalizing this, I'm not blaming patients, but being sensitive is not a bad thing. And when we have past traumas or fibromyalgia, these wind up. So any small little twinge, boom, you feel it emotionally, physically, etc. Now, ketamine, because this patient was coming to me for ketamine, and for the longest time, they were scratching their head. They're like, Doc, why do you keep talking about my emotions? I'm not depressed. I'm not anxious. Yet you keep talking about my emotional health. I want my back pain fixed. I just want my back pain fixed, doctor. This, I hope you now recognize, this is a symptom of a wound up central nervous system for many legitimate reasons. I'm not, once again, not blaming, not calling them fragile, not calling them, not gaslighting. But when somebody uses words, I just want this. If only this would happen, right? If only this, then that would happen. If only this, I would be happy. If only this, I would be comfortable. The second we catch ourselves saying if only or just, we know that we are beginning to enter a cognitively rigid state. Just like that wound up central nervous system, it's rigid. It's not flowing and resilient. It's rigid. The smallest twinge, boom, it will literally, it's like a trigger waiting to explode. The ammunition is within your body and your mind and your brain, perhaps stored there from a lifetime of trauma. But the same thing goes for rigid people. The more rigid we are, a small twinge, there is no room to let that rigidity expand. And what happens? We end up with feelings of hopelessness. We end up feeling disappointed. We end up suffering. We have no breathing room because we're so rigid in what our expectations are that we can't accommodate anything short of those expectations, no matter how unrealistic or toxic they may be. And that is one of the many benefits that something like ketamine can bring, not as a silver bullet, but as helping to relax the central nervous system, not just being relaxed and euphoric, absolutely not, but as allowing for neuroplasticity to help induce cognitive flexibility so that instead of snapping, we can accommodate. The age old proverb of the oak tree versus the willow reed is still very true today. And it's not just ketamine. They happen to be coming to me for ketamine. Mindfulness, meditation, any number of spiritual practices, exercise, good nutrition, etc., all go into helping foster cognitive flexibility. And what I'll leave you with is tolerance of uncertainty or tolerance of ambiguity. If you've ever felt like you cannot function when there are unknowns around you, that is a marker of intolerance of ambiguity. Not only does that underlie pain, but it also underlies imposter syndrome, underlies depression and anxiety, underlies so much physical and emotional suffering because they're largely one and the same because of the mind body connection. Fibromyalgia is but one example of the wound up central nervous system with impaired descending analgesia that we discussed yesterday. But there are so many other examples where the normal protective mechanisms of the brain and body are hijacked and subverted away from being able to normally accommodate the adversities that life throws our way, largely because of the fight, flight, freeze response that is chronically wound up in the central nervous system. Now, like I said, intolerance of ambiguity is perhaps one root cause, meaning that tolerance of uncertainty and tolerance of ambiguity are perhaps one of the many important solutions to address the root cause. As is my favorite fourth F, we always talk about fight, flight, and freeze. We never talk about a fourth F, what I call face, the facing it response. And I'll leave you with that. Facing the stimuli, not running away, not freezing in the face of it, not fighting it, not in ways that are harmful to ourselves. How about facing it, engaging it with curiosity? Why is this causing me pain? Why is this inducing rigidity? Why is this causing me to feel triggered, to feel rage, to feel anger, to feel any number of emotions that are destructive to myself and those around me? Facing your traumas and past or present, facing those traumas is something that we don't give enough attention to. And that's all it takes, giving attention to yourself and that moment between trigger and response where human being exists and we can escape the suffering of human doing. Human being present, mindful, compassionate, and respectful towards ourselves and others exists in that moment between trigger and behavioral response. Cognitive flexibility allows it to be lengthened, as does tolerance of uncertainty. I hope that you learned something new, everyone. Please share what you learned with others. Remember that you have more power over your health than you've ever been told. I'd always appreciate it if you hit that like button, share what you learned with others to help support me doing this more for you. Until next time.